Welcome back to Midday Kentucky, everyone. Georgetown Bariatrics and Metabolic Centre is on the forefront of providing metabolic surgery for the fighting diseases of type 2 diabetes and obesity here at Midday Kentucky. We love hearing success stories straight from the patient's mouth. Of course, we're joined by Dr. Eric Smith and his fantastic patient, Teresa Harmon. Welcome to the show, team.
Thank you so much.
All right, before we get going, I want to find out what surgery did you perform and why?
So she had a robotic sleeve gastrectomy.
Okay.
There's multiple options that they can choose from, and after education and based on her medical history and her preferences, that's what we felt was the best surgery for her.
Okay, well let's get into that, especially when you said your medical history. What were we talking about from both of you?
I had hypertension, I had terrible back pain, leg pain, trouble standing on my feet all day. I was borderline diabetic, so a long history of health problems in the making.
Okay. Any medication that you're on, Teresa?
Yes, I was on 4 different blood pressure medications, cholesterol medication.
Wow. And Dr. Eric Smith, this is something that you really advocate. When you have these type of surgeries, your main goal is to get them off the medication, correct?
Sure, absolutely.
Why is that such an important part of the process?
Well, those comorbidities, the medical problems that she mentioned plus others, in general, I tell people all the time, obesity doesn't kill people. It's the comorbidities that go along with obesity that takes people's lives. The diabetes that goes uncontrolled, that leads to kidney failure, it leads to heart disease. The cholesterol that goes uncontrolled, the sleep apnea that goes uncontrolled. And so if we resolve those medical problems, yes, in turn, we're doing that by reducing their weight, but their longevity and their life expectancy changes.
I remember someone was saying to me just recently, how much weight do you have to be before you can qualify for these type of surgeries?
Well, every insurance company is a little bit different, but in general, someone needs to be in the morbid obesity category. They need to have at least a BMI greater than 35.
Okay.
Some insurances will say if it's between 35 and 40 that you need another comorbidity like hypertension, diabetes, sleep apnea. If it's greater than 40, many times you don't need that. To qualify for it, irregardless of insurance, your BMI needs to be above 35.
Okay, perfect. Well, that's important information for everyone at home. So let's get to the success story, everyone. What weight did you start out at?
I was 327 pounds.
327 pounds. Let's bring up a before picture.
Okay.
Because when you hear that, you can't quite imagine it in your mind. Now, you had this surgery when?
December of 2016.
And how have you maintained?
I have lost an incredible amount of weight.
Yeah.
And
give us the number. Come on. Don't be shy.
130 pounds.
100. That's like half of me.
And have continued to keep that weight off with no issues.
This is something that's important. I wanted to ask you again, Dr. Eric Smith, that when you say you've maintained it, how has she been able to maintain it? Is it a strict regime of dietary needs?
Well, it's just learning how to eat right, learning how to incorporate exercise into your lifestyle. We give patients a tool. Their surgery is a tool. If you combine with that tool, learning how to eat right and exercise, then those results should be maintained. It takes hard work. She hasn't done this just by showing up for surgery. There's been a lot of effort on her behalf.
Let's keep bringing up those before and after shots, because as we look at them, I think to myself, did you ever think that you would get, look at you there, did you ever think you'd get to that?
No.
When was the last time, before you'd put on the weight and before you had the operation, that you felt you looked like that in thinness?
Never.
Never. Have you always had a weight issue in your life?
I have. Mm-hmm.
Why do you think that is?
I think a lot of it's genetics.
Okay.
A lot of it is just being in Kentucky. The way we eat here.
That good southern food.
Right. I mean, it's not like I hadn't tried other weight loss programs before.
Yeah.
But just not able to maintain the weight loss.
All right, and that's something I completely understand. And everyone sitting at home would also empathize with you because they have those thoughts as well. Telling people at home, what would you say about picking up that phone and making that first phone call if they had reservations?
So I think it's probably the wisest move I ever made. I visited all the weight loss clinics in Lexington. There are a lot. And basically decided to go with Dr. Smith because when I met him, he talked to me. He gave me the options that were available to me. And Georgetown Hospital, they specialize in bariatrics.
Yeah.
So why not go somewhere
He's-
that specializes in bariatrics?
He's the man.
He is.
He's performed the most surgeries, if not the most, correct, in America. We're going to make that claim right now.
That's right.
All right. All right, if you want to find out more information about this amazing surgeon, Dr. Eric Smith, there it all is up on the screen. Now, you can also give them a call. It's the best choice that you will ever make. Start a healthier life today. Thank you for both coming in. We'll be right back after this short break, everyone. You're watching Midday Kentucky.